बिस्मिल्लाहिर्रहमानिर्रहीम। इय्याका नअबुदु व इय्याका नस्तईन। अल्लाहुम्मा सल्लि अला मुहम्मदिन व अला आलि मुहम्मदिन व बारिक सल्लल्लाहु अलैहि। Dear colleagues, I am Dr. Sultan Ayub, working as a radiologist. This is a male, 13-year age, a patient with history of decreased appetite, off and on vomiting, and feeling weakness for the last 2 years. So I'm going to scan the abdomen to see any pathology within the organs. Here we can appreciate the liver, and this is the gallbladder, and this is the liver portal vein. This is the right hemidiaphragm and the superior upper towards the lung. So here we can appreciate no any pathology. So now I'm going to scan the kidney. Here we can appreciate the kidney. Look here, the kidneys are more echogenic than the adjacent liver parenchyma, and this is the sinus fat, and this sinus fat is more echogenic. So we can say that the kidneys are more echogenic. However, these are to some extent less echogenic to the renal sinus fat. However, this echogenicity is approaching to that of the renal sinus fat. So this is 13-year boy, and also we can appreciate the size of the kidney. I am going to measure it. Size of the kidney is 7.8 centimeter into 3 centimeter. So in this age group, I have commonly seen that the size is more than 9 centimeter, with a few exceptions. When we see the kidneys that these are echogenic, then the size also matters. So here we can say that the size is decreased. Right kidney has decreased size, echogenic, more than the liver, slightly less than the renal sinus fat. However, it is approaching to the echogenicity of the renal sinus fat. So I'm going to see the other. So this is the spleen, and this is the kidney. So this kidney also has the same finding. Echogenic kidney more than the adjacent spleen, approaching to the renal sinus fat echogenicity. And if we measure the size, The size is 8 centimeter and width is 3 centimeter. So it is 8 into 3 centimeter. So it means this is also small. So when we are going to examine such conditions, so here we can use the linear probe to see the further clear picture of the kidneys. So we already have get the comparison between the sinus fat, between the liver, spleen. Now I'm going to see the corticomedullary differentiation. How we this is not any method to calculate quantitatively. However, we try to differentiate it with our observation. So here we can appreciate the kidney with this is the kidney parenchyma and this is the sinus fat. So I'm trying to find the pyramids. When we talk about the medullary corticomedullary differentiation or CMD, then we focus on the medulla, which are the pyramids, and then we compare the pyramids with the cortex. Here we can appreciate that this vitreous tissue cortex up to this, while I am unable to find the pyramids. I'm trying to see the other kidney. So in this age group, 13-year age, the pyramids are very clear when I come across in such patients with normal kidneys. The significant hypoechoic pyramids we can see in this age group, and the cortex is relatively brighter than uh, almost gray in color, and we can easily appreciate the pyramids and the cortex. So when we talk about the corticomedullary differentiation, we should compare the cortex with the pyramids. So this is the cortex. This is the cortex. I cannot. This may be the pyramids, but however, these are indistinct. We can't clearly appreciate the pyramids in such kidneys. In these kidneys, I am trying, I am unable. So when we talk about the corticomedullary differentiation, we should compare the cortex with the adjacent pyramids. Then we decide about the either it is a good CMD or decreased CMD or loss of CMD. CMD means corticomedullary differentiation. So look here, we can appreciate that when there is a increase renal parenchymal echogenicity, but the pyramids are well seen, well recognized. So we can say that the parenchyma echogenicity is increased, but the medulla is a pyramid is normal looking, so is the preserved CMD. And when we see that the cortex is hyperechoic and the pyramids are visible but difficult to differentiate between the difficult mean just difficult nor much more, then we can say that the CMD is decreased. CMD is decreased, corticomedullary differentiation is decreased. And when we appreciate that the cortex is bright, echogenic, and the CMD, this may be CMD is also, or sorry, pyramids are not visible, or we are unable to differentiate between the cortex and the pyramids, or we are feeling difficulty, significant difficulty to differentiate pyramids and cortex, then we can say that there is loss of CMD. Corticomedullary differentiation is lost. So this was about the how we can observe the CMD. So in this fellow, the kidneys are small in size, echogenic in echotexture, and there is loss of corticomedullary differentiation. So we can say that this is grade 3 renal parenchymal disease, or in my experience, such kidney which are small and such condition, and we can call it the chronic kidney disease, and the outcome is very poor. And this is, in my opinion, this in his creatinine level would be more than 5, 6. In my self experience, I would not talk about any other formula. So, in my experience, so this was I want to tell you about the how we can observe the corticomedullary differentiation. How can we observe the uh, cortex echogenicity comparing with the liver and spleen and then the renal sinus fat, so that we can give the clear-cut picture, clear-cut description, report, clear-cut to the nephrologist. He can then decide how to treat the patient. So whenever we are going to differentiate between the cortex and medulla, we can use the linear high frequency probe uh, so that we have clear visualization of cortex and medulla, and also the renal sinus fat, which seems to be this. So in conclusion, we can say that it most likely it is the chronic kidney disease CKD with smaller kidneys and increased parenchymal echogenicity with loss of CMD grade 3, and grade 4 will be when the kidneys are echogenicity is equal to the, this is the renal sunspot. So echogenicity is similar to that of the renal channel spat. So this was all about this pathology in the kidneys, and then the patient will go to the kidney center to have further investigation and management. Thank you very much.